So when patients come to clinic, the easiest way to explain what we're going to be doing when we're talking about a knee replacement is to describe the procedure to them. And the simplest thing I can say to them is that we're going to cut out the diseased bone and we're going to replace it with metal and plastic. So when we look at the x-rays, this is the right side, this is the left side. This is the femur, the thigh bone, tibia, leg bone, fibula, small little bone on the outside that serves as a muscle attachment, and then the patella, kneecap. X-rays are great at showing bones. They don't show soft tissue really well. So the space between the bones is made up of articular cartilage, which is the white shiny stuff on the end of a turkey leg or a chicken bone. And as that goes away, that's arthritis. And so you can see here on the inside of their left knee, it's bone on bone, and if there's no space left, all that cartilage is gone.